Hi, my name is Jane. I will talk to you about autism and what you need to know.
What is autism?
Autism spectrum disorder is a condition related to brain development. Difficulties with social interaction, verbal communication, and participating in play activities are all common struggles. It can be difficult for the person to make eye contact, understand other people's feelings, and often repeat words or phrases. Other symptoms are repetitive behaviors such as rocking, flapping, or spinning back and forth. As seen here, this is a visual representation of flapping. This is an example of how a father communicates with his autistic son. Simple words and simple sentences are used. Children with autism may find it challenging to make changes in their daily routines. They have delayed language development and unusual, intense reactions to sounds, smells, tastes, textures, lights, and colors. As better explained by the CDC, these interventions may reduce symptoms, improve cognitive ability and daily living skills, and maximize the ability of the child to function and participate in the community. Let's talk about what some of these things may be. Discrete trial training is a style of teaching that uses a series of trials to teach each step of a desired behavioral response. Lessons are made simple, and positive reinforcement is used to reward correct answers and behaviors. Incorrect answers are ignored. Each person is different and displays different characteristics of the disorder, so treatment can look different for everyone. There is no cure for autism, but some things may help the child better adapt.
Occupational therapists help with feedings, dressing, bathing, relating to others, and so much more.
Physical therapy, social skills training, and medications can also be used to help one with ASD function better. We want to promote as much independence as we can. Local education systems can help specifically in school. An individualized education plan that is a resource for your child. Communication boards or electronic tablets. Picture Exchange Communication System, PECS, uses picture symbols to teach communication skills. Tablets are used as a speech-generating or communication device. Let's now talk about some important safety. Use locks and alarms on exterior doors and windows to alert you if the child is leaving the home. Cover or remove electrical outlets and access to electrical appliances. Use plastic knob covers for doors, faucets, ovens, and stoves. Lock doors to the laundry room, and ensure that all wiring for appliances and electronics are concealed out of the reach of the child. Children with autism tend to have a curious interest in how things work. Lock hazardous items away such as detergent, chemicals, cleaning supplies, medications, and pesticides. Keep poison control phone numbers in a permanent place with easy access. Children with autism tend to have a curious interest in how things work. There is no medication that can cure autism spectrum disorder. There are medications that can help treat specific behaviors. Some of the behaviors that medications help to reduce are self-injury and irritability. Decreasing the symptoms aids so that the patient can focus on other things like learning and communication. With research and evidence-based practice, medication has shown most effective when used together with behavioral therapies.
One of the medications approved by the FDA for children with autism spectrum disorder is risperidone. It is an atypical antipsychotic and can be prescribed for children between ages 5 to 16 years old. Risperidone can help decrease irritability symptoms. Common side effects of risperidone include drowsiness, constipation, fatigue, and weight gain. Other more severe side effects are suicidal thoughts, neuroleptic malignant syndrome, and tardive dyskinesia. It is important to monitor for any of these adverse effects, especially abnormal movements.
Another medication that is used to treat autism spectrum disorder is aripiprazole. This is an antipsychotic medication. It can help treat behaviors like aggression, temper tantrums, and frequent mood changes. It is prescribed for children between 6 to 17 years old. Some common side effects of aripiprazole include nausea, vomiting, drowsiness, constipation, headache, and weight gain. Other more severe side effects are tardive dyskinesia, neuroleptic malignant syndrome, shaking, muscle spasms, fainting. It is important to monitor for any adverse effects, especially abnormal movements. Contact healthcare professional immediately if patient has these severe effects.